The Community Memorial Health System Fall 2021 Speaker Series Online is brought to you by Mission Home Health. Mission Home Health and Hospice is committed to taking care of people by providing the highest quality, cost-effective care wherever the patient calls home. With over 14 locations, Mission delivers skilled home health, hospice, and palliative care services to more than 3,000 patients a day. As a preferred partner with several health systems, Mission works with providers to customize each partnership to provide exceptional coordinated care. Visit our website to learn more at www.homewithmission.com. We take care of people, and one call does it all.
Good evening, and thank you for joining us tonight. My name is Sheila.
And I'm Megan.
And tonight we're going to talk to you about baby-friendly hospital designation and the New Parent Resource Center. Take it away, Megan.
My name is Megan Rodarte, and I've been a registered nurse for almost 30 years. Although I started my career in the ICU, I spent most of my bedside time in labor and delivery. I have been the director of maternal child health here at Community Memorial Hospital for over 14 years. So I'm going to talk to you about the baby-friendly designation that we received in 2018. Simply put, baby-friendly designation means that our hospital is a center of excellence for breastfeeding and mother-baby bonding. It's really not about requiring all moms to breastfeed, but it's about setting up our hospital systems, practices, and policies so that a mom who chooses to breastfeed has the very best chances of success. It's a global program that was sponsored and created by WHO and UNICEF to recognize and encourage hospitals and birth centers that offer optimal levels of care for infant feeding and mother-baby bonding. So why is it that we promote breastfeeding here at Community Memorial? Breastfeeding is good for babies, for mothers, for the community, and the planet. The advantages to babies are multiple. As you can see here on the screen, there's a decreased incidence of many diseases and conditions for an infant who is breastfed. There's also advantages for mothers. There's lower risk of breast cancer, ovarian cancer, type 2 diabetes, as well as high blood pressure. So it's really a great thing for mothers to health as well. There's also advantages for the community and the environment. Research has shown that if 90% of moms would exclusively breastfeed for 6 months, we could save $13 billion annually. And we could prevent an excess of about 911 deaths per year. And more breastfeeding means less pollution from raising dairy cattle, transporting, manufacturing, formula, plastic waste, etc. American Academy of Pediatrics recommends that we breastfeed exclusively for the first 6 months of life, and that breastfeeding is the optimal source of nutrition throughout the baby's first year. You should exclusively breastfeed for the first 6 months and then start adding complementary solids at about 6 months and continue breastfeeding till the baby's first birthday without feeding anything in those first 6 months other than breast milk. Babies and moms can continue breastfeeding for as long as it's mutually desired. So it's important to exclusively breastfeed for those first 6 months and not feed any other foods or liquids, except for any medications, vitamins, or mineral supplements that are recommended by your pediatrician. Babies who are exclusively breastfed tend to breastfeed longer, and those moms who are breastfeeding make more milk for their babies. Babies also have better immune protection from illness, which is so important today at this time in our history with this pandemic. So baby-friendly consists of 10 steps to successful breastfeeding. They were developed by a team of global experts and consist of evidence-based practices that have been shown to increase breastfeeding initiation and duration. And I'm going to tell you what the 10 steps are. The first step is that we comply fully with the International Code of Marketing of Breast Milk Substitutes, and that means that we don't advertise or accept gifts from formula companies. We also have a written infant feeding policy that is routinely communicated to staff and parents, and we have a copy of it on our wall in the hospital in the mother-baby unit. We also have established ongoing methods of monitoring our data to make sure that we are providing the best level of care and to watch our breastfeeding rates. The second step is to ensure that our staff have sufficient knowledge and competencies and skills to support breastfeeding. Each of our registered nurses has 20 hours of specific breastfeeding education, and all other hospital staff receive specific education to their role in the hospital. Our mother-infant pediatricians, obstetricians, and providers also receive specific breastfeeding education, as do our educators in our clinics. The third step of the Baby Friendly Initiative is to discuss the importance and management of breastfeeding with pregnant women and their families. That's why we provide some breastfeeding classes at our New Parent Resource Center, as well as in our clinics, specific education for breastfeeding. The fourth step is to facilitate immediate and uninterrupted skin-to-skin contact and to support mothers to initiate breastfeeding as soon as possible after birth. The fifth step is to support moms to initiate and maintain breastfeeding and to manage common difficulties. This is why we have specific lactation consultants in the hospital, where if you're having any issues or specific needs above the routine support, then we have a lactation consultant that is available to help you. And the sixth step is to not provide breastfed newborns with any food or fluids other than breast milk, unless, of course, it's medically indicated. The seventh step is to enable mothers and their infants to remain together and practice rooming in 24 hours a day. And that is specifically so we can meet the goals of step 8, which is to support moms to recognize and respond to their infants' cues for feeding. We used to feed babies on a schedule, but that's no longer the recommendation. The current recommendation is that you watch your baby for feeding cues, and that's what we teach our moms to do while they're in the hospital, so that you can recognize when the baby wants to feed, and we feed, as we call it, on demand. The ninth step is to counsel moms on the use and risks of feeding bottles and artificial nipples and using pacifiers. Pacifiers are recommended after about 4 weeks when breastfeeding is well established, but prior to that is not recommended. The 10th step is to coordinate discharge so that parents and their infants have timely access to ongoing support and care. And that is why we have our New Parent Resource Center to provide that awesome level of support for you after you leave the hospital. And so I'm going to turn it over to Sheila at this point to talk to you and explain to you what we have to offer you at our New Parent Resource Center.
Thank you, Megan. I've already introduced myself. I've been at Community Memorial Hospital since 2004. However, I did start my career here as a 20-year-old registered nurse back in 1979. So I have many years of experience in maternal child nursing. At the New Parent Resource Center, Megan and I actually realized that there was a need in the community. The need was for parents to have a place where they would feel comfortable, where they could get evidence-based information, and all of that wrapped up in a warm and loving atmosphere. So we have carved out classes that are for before you deliver your baby, as well as after you deliver your baby, and support. So our pregnancy classes, all of them before your baby arrives, that we currently hold. One of them is a virtual prepared childbirth class. We understand in this day and time during the pandemic, we needed to make some changes. So that's when we decided to make the virtual class. The virtual class is a 6-week class, and it's for 2 hours a night, and you can join through Microsoft Teams. And the goal of that class is to help you to prepare for the birth of your baby and get that desire that you want out of your birth experience through education and different tips to help you through it. However, we do recognize that sometimes medical intervention is necessary, and so we teach you all about that too, so you feel comfortable with everything that you may experience in your labor. The course cost is $125 per couple, and that's for the entire 6-week series. Registration is required, and you would again join through Microsoft Teams. We're really excited because we heard a shout out from the community of just how much they wanted to try hypnobirthing. So we did get certified in hypnobirthing, and we're happy to tell you that starting in 2022, we will be offering that class. It is also a prepared childbirth class, but specifically hypnobirthing. It prepares the birthing couple both physically, mentally, emotionally, and spiritually for an easier, more comfortable, and sometimes pain-free birth, although, of course, that's never recommended. Not recommended, never guaranteed, I should say. The class is 2.5 hours long, and it's held for 5 sessions or 5 evenings, and we are able to offer that class in person because we're able to meet the recommendations for how many people we can have in the classroom, because we only are able to bring in 5 couples for that class. Again, that class is also, registration is required, and you can register by calling the New Parent Resource Center. Another before baby class we offer is prenatal yoga. We do know that yoga is one of the most effective ways a mom can prepare her body for birth, and it is taught by a certified yoga instructor once a week. The fee is $10 per class. Pre-registration is required because the class size is limited, and that class is held at our Community Memorial Hospital Fitness Center. Once your baby is born, some people feel like, now we've gone home, now what? What do we do? So we have these great classes for you and support once your baby is here. One of them is our class called Our Babies Ourselves. We used to hold classes that were just centered around the baby, and then we realized you have created a family. So this class is 1.5 hours long, and it's an 8-week session. And it's for parents with infants up to 3 months of age. The class provides both group support as well as infant development education. Topics you can see there. What about that adjustment to having a new baby? How's baby adjusting? But also, how are you adjusting? Respectful care for the baby. Also remembering to respect ourselves while we're making this transition. Babies do communicate through cries, so we have a class on crying. How do you manage that? As well as all the mommy emotions that happen when you give birth to a baby. Infant sleep is always a big topic of concern. So we have a class on that, and how can we promote parents or enable parents to help them to get some sleep as well. Your baby's brain is rapidly developing, so we don't want to forget that. And then also, what about mommy brain? Most moms get mommy brain, so we have a class on that. Feeding your baby, all the way from breastfeeding to when, or if you are formula feeding, also we talk about that. And then what about that introduction of solids? How do you do it? And then what about mom? Is she getting enough food herself? Is she meeting her own dietary needs? And then another class we have is your baby's developing physical development, as well as I gave birth to a baby. What about my body? So we talk about that. And then our last class of the series, we do infant massage. Infant massage is a great way to connect with your baby. We also talk about mommy massage, not mommy massaging herself, but about ways that moms can make themselves feel more comfortable. We offer also, for our breastfeeding support, we offer a virtual breastfeeding support class. This class is facilitated by a board-certified lactation consultant. It is a 2-hour support group. There's no fee to join. However, you do need to register so we can add you with your email to the list. We recognize that about 1 in every 5 women do suffer from perinatal mood disorder, and that's statistically proven. So we have an emotional support group. Symptoms can appear anywhere from pregnancy all the way up to your baby's first birthday. So the group meets weekly. There's no fee to join. Again, pre-registration is required so that we can make sure that you can join Microsoft Teams. since it is virtual. One of the busiest things that we do at the New Parent Resource Center currently is offering individualized, private lactation consultations with you and your baby. We assess your baby's feeding, we provide education and support, and we help you to develop a plan that meets your needs with your goals in mind. The consultations are done by a board-certified lactation consultant, and they're offered at no charge if you delivered here with us at Community Memorial. If, however, you did not, there's a one-time, very nominal fee. Appointments are required, so we make sure that we have that time to spend with you. And the consultations last right about an hour. So how do you know when you want to see a lactation consultant? That term IBCLC is our acronym, if that's confusing you a little bit. Some moms have sore nipples, painful nursing, a painful breast nipple latching issue. Sometimes they're concerned about their milk supply. Sometimes they have an oversupply or a very forceful milk letdown, or they're dealing with engorgement. Now for the babies, the reason we see people is they're worried about, is their baby getting enough? And I read a study, Megan, that said the number one reason why women quit breastfeeding is that concern. Is my baby getting enough? They'll deal with pain, but that's a big concern with them. So we have the ability to make sure your baby is latching correctly. We also do what we call a test weight, where we can see how much is your baby getting. We work at babies being fussy at the breast or pulling away from the breast, and we fish all this out for you so we can give you a wonderful plan to go home with. So what happens at that consultation? We want to find out from you, what are your goals? What is your concern? We want to make sure we're meeting your needs. We take a history on you because the history helps us to decide, along with the consultation, what the best thing is to help you move forward. We weigh your baby. We evaluate your feeding. We teach you how to latch your baby correctly. And as I mentioned before, we can do what's called a test weight to see that your baby's getting enough. And we always send you home with a written plan of how to move forward, as well as making sure you're understanding what it is that we've taught you. The consultations last approximately an hour, and we do, again, need to schedule those for you. We have at the New Parent Resource Center what we call our breastfeeding boutique, and we have bras, we have pump part supplies, we have all different breastfeeding supplies there for you. So if it's something, especially when you have a new baby, who wants to run to the store or worry about trying to get something in 2 or 3 days? So we do have many supplies there for you for your convenience. And we rent professional grade breast pumps. Now, the reason I'm mentioning this is that for some moms, studies show that if they're having a milk supply issue, especially if their baby's in the NICU, those can really help them with their milk supply to use that type of pump. So here is our address. We're at 2580 East Main Street, Suite 101 in Ventura. We are on the corner of Main and Catherine, but I want to let you know, if you're coming in, you want to park behind us, which is San Nicolas Street, because that's where we enter. Thank you for joining us. And any questions?
So the first question that we see coming through is, if I choose not to breastfeed, what kind of support is provided? Well, we definitely, part of the Baby Friendly Initiative also is respecting mom's choices for feeding. So if a mother chooses to formula feed, then we do teach you how to appropriately feed your baby, how to hold the baby, how to mix the formula, all of the things that are necessary, when to feed, and to continue to watch for those cues. So we absolutely support you in whatever your choices for your infant feeding goal.
And I want to add to that, when you are formula feeding your baby, we want to make sure you know how to properly mix formula, the difference between the formulas, whether that's powder, concentrate, or ready to feed, and how to do that safely.
Right.
All right. Will you be having an evening yoga classes as well? At this point, we don't have a plan for that. We have, through the years, modified what we do based on what the public is telling us. So it would depend on if we really had a lot of need for that.
The next question we see is, do I need to select a pediatrician prior to birth? Yes, that is very important that you do select a pediatrician prior to birth so that when you come in, we have a physician to call when your baby's born to notify the physician and to get the orders to properly care for your baby. So it is important to do that.
We are planning to start our first hypnobirthing class that first week of January. So the 2022 schedule is going to be coming out by next week.
What paperwork do I need to complete prior to admission for labor? We recommend and request that you would pre-register for your hospital admission. You can do that on our website, mycmhbaby.org. Or is it .com?
.org. It's .org.
And so the other option is you can also come into our admitting department in the Ocean Tower first floor to complete the paperwork and get pre-registered.
You actually can continue to practice prenatal yoga up until delivery. We honestly have some moms that have gone past their due date and they're really hoping that that's going to get them going. However, when can you start prenatal yoga is another question. We want to make sure that that placenta is well implanted. So we're not recommendation for that until you're about 4 months. This is a great question. How does hypnobirthing differ from other childbirth preparation methods? We have always prided ourselves in our prepared childbirth class that we want to teach parents everything from what to expect to what other things can come up. Hypnobirthing has a focus of everything is going to happen natural. It's not that they ignore that things, you may have other things going on, but they do have that focus. And also they teach you how to do some self-hypnosis, some affirmations. So that's where it's a bit different, I'd say.
And I think one of the big things about hypnobirthing is it's empowering you as a woman to trust your body and to do things that are natural, which delivery is a natural phenomenon. So,
and I find it interesting because the founder of hypnobirthing, she felt like every time you turned on the TV, there was a birth that was scary or that you were coming into this with fear. So they actually have little pins that say, don't tell me your birth story, my baby's listening. Because we want to come into it with hypnobirthing, with everything, with a very positive state of mind and affirmations and being able to do some self-hypnosis. And it really can be helpful.
The next question is, are you able to dim the lights in the delivery room and offer different laboring positions? We absolutely can dim the lights during the labor. At the time of delivery, typically the physicians like to have the lights on. We do have these lights in the ceiling that are directed completely at the area that is needed, but they can be absolutely dimmed during the labor process. We also provide a lot of labor support. All of our nurses are trained in labor support, and we have a lot of tools available to you, like aromatherapy. We have a relaxation channel on our television. We've got soft music. We've got birthing balls. We have peanut balls and tennis balls and all kinds of things to provide labor support to help you get through this challenging moment.
And may I add also that Megan headed up a great team for labor support. So they recognize that there was a need for that, and all of our labor and delivery nurses are trained in that.
We are currently not offering in-person tours due to the pandemic. That's why we had to get into a virtual tour, and we've created a virtual tour that we'd like to share with you at this time. You can also access this virtual tour anytime on our website, mycmhbaby.org.
Memorial Hospital. We are excited to show you around our hospital and share what you can expect when it's time to deliver your new baby. From pregnancy to parenting, Community Memorial Health System is here to support your unique journey as a family. At the conclusion of this video, we encourage you to visit mycmhbaby.org for more valuable information to help you prepare for your birth experience and to explore all the resources available to you. That's mycmhbaby.org. To streamline admitting when it's time to deliver your baby, we ask that expectant mothers complete our hospital pre-admission process at least 1 month prior to their due date. You can stop by the admitting office to provide your personal information, or you can start the process at mycmhbaby.org. If you think you are in labor, the first step is to call your doctor. He or she will tell you if it's time to come to the hospital. You should also call your doctor if your water breaks, if you have contractions that have been 5 minutes apart for an hour, or for any other concerns. When you arrive at the hospital to deliver your baby, you can pull up to the front door of the hospital and let the mom-to-be out of the car prior to parking. During busy weekday hours, the CMH valet is available to park your car. In the evenings and on weekends, or if you prefer to park your car yourself, please use the parking structure in front of the hospital. Be sure to adhere to all posted signage and time restrictions. The main entrance to CMH is open during daytime hours, and the emergency room entrance is open 24 hours a day, 7 days a week. Anytime you come to the hospital during the pregnancy, and when you arrive to deliver your baby, if you are arriving to the hospital during daytime hours, you will come directly to the 3rd floor, labor and delivery unit. And if you are arriving at night, please stop at the emergency room admitting desk and check in before coming to the labor and delivery. Our labor and delivery department is located on the 3rd floor of the hospital. When you get to the door, use the phone on the wall to talk to one of our nurses. They will open the door for you. When you arrive at the labor and delivery department, your nurse will evaluate your condition, assess how your labor is progressing, and discuss the situation with your doctor. If you are in very early labor, we may send you home and ask you to return when you're further along. We encourage you to have a support person with you in labor and delivery. Other visitors are normally allowed, provided that the environment remains safe, we have enough space to provide the needed care, and as long as visitors are supporting you in your birthing experience. However, we ask that you not bring visitors other than your support person until you know you are going to stay. As your due date approaches, please visit mycmhbaby.org to check our most up-to-date visitor policy. Labor. Once the decision has been made that you will stay in the hospital and things are progressing normally, you can get up and walk in your room or the hall, sit in a rocking chair or on a birthing ball, or take a shower. If you'd like to take a bath during labor, ask for a room with a bathtub when you check in, and we will do our best to accommodate your request. If you need an IV during labor, your nurse will explain why it's necessary. You may discuss getting pain medication or an epidural, or other desires for your labor and delivery experience with your labor and delivery nurse, your midwife, or your doctor. Educational videos about labor and delivery are also available on the TV in your room. You can bring a camera to take photos and videotape before and after delivery. However, you may not videotape during the delivery. Delivery. When your baby is born, the umbilical cord will be clamped and cut. Your support person may help cut the cord if he or she wishes to, and the medical staff determines it is safe. Your baby will be placed skin to skin on your chest for you to see and hold. Putting your baby skin to skin on your chest will help your baby's vital signs and blood sugar stabilize, calm your baby, and help support breastfeeding. After your baby is born, a nurse will examine your baby and notify your designated pediatrician that he or she has arrived. An antibiotic ointment will be applied to your baby's eyes to help protect them from germs, and a vitamin K injection will be administered to support blood clotting. After a couple hours of recovering, you and your baby will be transported to your postpartum room together. Your baby will have a bassinet. The bassinet drawer will contain diapers, wipes, and blankets for the baby. Cesarean sections are performed in special operating rooms located in the labor and delivery department. Your support person may attend the cesarean section, but no other visitors will be allowed in the operating or recovery rooms. In the rare case of an emergency cesarean section, your support person will not be allowed into the operating room. If you and your baby are well at the time of cesarean delivery, and the obstetrician and anesthesiologist approve, your baby may be put skin to skin on your chest after delivery. After some time, a nurse will take your baby and support person to the recovery room. When you arrive in the recovery room, your baby may be placed on your chest again while you are recovering. You will be in the recovery room with your baby and support person for about 2 hours after the cesarean section. And then the three of you will be transported to your postpartum room. If your baby needs extra attention or care after delivery, your baby may be taken to the Neonatal Intensive Care Unit, or NICU, also located on the 3rd floor. Parents may visit the NICU 24 hours a day. The NICU does a great job of taking care of babies that need extra attention after birth. If your baby needs this type of care, you will be provided with all of the necessary information, and a social worker will be assigned to assist you throughout your baby's stay. Postpartum rooms are also located on the 3rd floor. Your baby will room in with you, which means your baby will stay in your postpartum room until you are both discharged. Keeping your baby with you encourages successful breastfeeding and enables you to become comfortable in your new parenting role. If you need any assistance with your baby, your nurse is there to help. Vaginal delivery patients generally go home 1 or 2 days after a baby is born, and cesarean section patients generally go home 2 to 4 days after a baby is born. Postpartum. Your postpartum room bed will have a call light and TV and lighting controls. Please use your call light to ask for assistance to the bathroom, for pain medication, or any other needs. Educational videos about moms and babies are available on the TV in your room and are accessible using your bed's remote. We encourage your support person to stay with you throughout your hospitalization. There will be a sofa that folds out into a bed for your support person to sleep. For all other visitors, please visit mycmhbaby.org to check our most up-to-date visitor policy. Safety. Your baby will have 2 ID bands and 1 alarm band. You and your support person will each have an ID band that matches your baby's. The ID bands will all have the last name that the mother is admitted under. The alarm band will set off the alarm if someone tries to remove the band, or if your baby gets too close to a hospital exit. If any of the bands need to be adjusted, please let your nurse know. If anyone comes to your room to take your baby for a test, please make sure they are wearing a hospital name tag with their photo and name. Only maternity staff wearing a unique hospital name tag and special color of uniform, the maternity staff, should take your baby from your room. If we take your baby out of your room, your support person can come along with us. If you have any questions, ask to speak with your nurse before allowing anyone unfamiliar into your room or to take your baby. If you walk in the hall with your baby, he or she must ride in the bassinet, not in your arms. Postpartum Folder. In your postpartum room, you will find a folder containing the following papers you will need to read and fill out. Souvenir birth certificate form. Legal birth certificate form. Social Security form. California State Newborn Screening Pamphlet. Hearing screen information. Hepatitis B vaccine information sheet. Baby photograph information. Breastfeeding education. Several people will come by your room the morning after the baby is born to pick up forms and answer questions. Please have the forms filled out as soon as possible after delivery. Breakfast, lunch, and dinner will be brought to you in your postpartum room. You will be given a menu to choose the food you would like to eat. Your support person can purchase food in the Brent Street Cafe, located on the 1st floor of the hospital. CMH also has gourmet meals if you'd like to order one in celebration of your new baby. Ask your nurse for this special menu. Feeding your baby. As a baby-friendly designated hospital, CMH encourages and supports exclusive breastfeeding, and our nurses are trained to provide breastfeeding assistance during your stay. At the same time, we are committed to supporting each individual's parents' feeding decisions for their baby. Please don't hesitate to ask for help as needed. We also encourage you to make an appointment at our new Parent Resource Center after delivery for any additional breastfeeding assistance you may need. Visit mycmhbaby.org for details on the resources available at the new Parent Resource Center. What to bring? CMH provides hospital gowns, pads, and underwear for you to wear during your stay, but you may bring some of your own belongings as well. Visit mycmhbaby.org for a list of suggested items to bring from home. Diapers, wipes, and blankets for your baby are also provided during your stay, but you will need to bring clothes and a blanket for the baby to go home in. You will need a car seat for your baby. The car seat should be new, or you should be sure that it has not been in an accident and it has not reached the expiration date listed on it. We highly recommend you have assistance with your car seat installation by the California Highway Patrol. Many fire stations also install car seats. Visit mycmhbaby.org for a list of phone numbers. Please call to make an appointment. Car seat installations are free of charge. Please label any belongings you bring to the hospital with your name. Do not bring valuables to the hospital. On the morning of your discharge, please ask your support person to take all your belongings to your car. Please double-check that nothing is left behind. Feel free to take the disposable supplies from your room, such as diapers and wipes, but leave the linens, blankets, and baby t-shirts in the room. If you had a cesarean section or are still unsteady on your feet, you will ride out of the hospital in a wheelchair. In this case, your baby's car seat can be waiting in the car, and you will carry your baby in your arms while sitting in the wheelchair. If you did not have a cesarean section, and you and your nurse both feel that you are steady on your feet, you may walk out of the hospital. In this case, your support person will carry your baby in his or her car seat. We know that bringing home a new baby is exciting, but can also be a challenging time for you and your family. We're here to help. The Community Memorial Health System New Parent Resource Center is available to answer any questions you may have and offers a variety of resources, including prepared childbirth classes, prenatal yoga, support groups, private lactation consultations, and new parent classes. Breastfeeding may come with some unexpected challenges. Our team of registered nurses, who are also international board-certified lactation consultants, are here to provide support and education to help you meet your personal goals. We offer private, in-person, and virtual lactation consultations in a warm, caring, nurturing environment. In addition, we offer breast pump rentals and a breastfeeding boutique with items to meet all of your breastfeeding needs. Visit mycmhbaby.org or call 805-948-BABY for more information. Thank you for choosing Community Memorial Hospital for the delivery and care of your baby. Giving birth is one of the most meaningful and memorable times you and your family will ever experience, and we are honored to be a part of your journey.
Well, Megan, it looks like there's a few more questions rolling in.
Okay, so the first question that we see is, do partners of laboring moms need to follow any specific COVID protocols? And yes, we do. There is a state order right now that requires that visitors to the hospital have a negative test within 72 hours or have proof of vaccination to enter the hospital. Of course, if you don't have that, you would be considered an essential visitor, and we would let you in with an N95 mask, and we will ensure that you get a test. We require the partners to wear masks the entire time that they're in the hospital. And wash your hands and do all of the other things, social distancing, and all of the other important COVID requirements.
We have a question asking about, do we offer classes in Spanish? We absolutely do through our Centers for Family Health. They offer a variety of classes, actually. At the New Parent Resource Center, just as I mentioned before, we love to stay current with what our population is telling us. So if we do have a need for that, if we have people asking for it, that is absolutely something we would reconsider.
Can siblings come into the hospital? Unfortunately, at this time, due to COVID-19, we are not allowed to allow siblings to come into the hospital. Under a non-pandemic situation, we do allow siblings to come visit, but at this time, unfortunately, we cannot do that. The next question is, do I have an option for intermittent fetal monitoring? Absolutely. We have our nurses trained in the ability to provide intermittent fetal monitoring. In fact, we encourage that so that we can get you up and keep you moving. We also have a type of monitor called the Novi, Monica Novi, where it's a Bluetooth type monitor, and that one you are able to move around and not be tethered to the machine. We also have telemetry monitoring that allows you to go down the hallway and remain monitored. So it really depends on the situation of your birth and your labor experience and your physician's orders. If everything's going well and normal and there's no requirement for monitoring, we definitely do intermittent monitoring and take you off the monitor and let you get up and move around. Of course, there's certain times and certain reasons during a labor process that we want continuous monitoring, but that's when we might use some of our other devices that would allow us to monitor you without keeping you in the bed. The next question is, in the event of an emergency during birth, is there a team experienced in bloodless interventions? Absolutely. We have a transfusion-free program. You will be asked if you would accept blood upon admission, and if not, then we have some specific questions about what you will or won't accept, and we explain to you all of the things that we have to offer in our transfusion-free program. Will you have to wear a mask during labor? If you were COVID positive, we would ask that you wear a mask. And of course, during certain phases of labor, it becomes difficult, and we understand that. And we're going to do the best we can to keep you comfortable and keep you, everybody safe. But if you're COVID negative, we would not, particularly during pushing, it's really hard to have a mask on. So we are able to accommodate removing the mask during certain parts of the labor, particularly if you're COVID negative. Yes, all of our labor rooms are private. In fact, even our postpartum rooms are all private. Our new hospital is all private rooms. We do have a triage room, which has multiple bays in labor and delivery. So it's a room with 4 bays that have curtains for privacy. But that is a room that we have people come, and when we're not sure if we're going to admit them or not, or if they're just coming for a particular type of test, then you may be in the triage room, we call it, potentially with other people, maybe alone. But if you're laboring and you're being admitted, you will absolutely be in a private room.
If I will be having a C-section, should my partner and I still attend prepared childbirth class? We do have people who know that they're having a scheduled cesarean section, and they still love to come to the class. Part of the class is all about labor and the whole labor process. Another part of the class is what happens after the baby's born. What about breastfeeding? What about your newborn? What about what's going on with you after the baby? So it would be a personal choice if you would want to do that. If you only wanted to attend the breastfeeding portion, or if you only wanted to attend the newborn portion, you can also do that. And it's a smaller fee just to attend those two than the entire program.
The next question is there an anesthesiologist available 24/7 at your hospital? And the answer to that is yes. And a dedicated OB anesthesiologist is available 24/7 at CMH. The next question is, does our hospital facilitate cord blood collection and storage? We do facilitate that in terms of we are prepared. If you bring a blood collection kit with you, that's usually a third-party company that you engage with, and you bring your kit and you tell us at the time of admission that you want your cord blood saved, then we will be prepared for that, and we do that for people whenever it's desired.
Another question, are lactation consultations free despite your insurance provider? Absolutely. When you've delivered at Community Memorial, they're 100% free.
The next question is about delayed cord clamping. That is definitely a part of our normal process. There would be specific times and reasons that cord clamping may not be in the best interest of you or your baby, but in general, that is something that we do with every birth. And the next question is, what is delayed cord clamping? Delayed cord clamping means that you don't clamp the cord immediately upon birth, but it can be, it depends on what you want. If some people want the cord to not be clamped for a certain period of time, sometimes it's just a delay. So it really depends on what your expectations and your desires are. And at the time of admission, we ask you what your preferences are, what your birth plan is, what your goals are for your labor and your delivery, and we would respect and honor your wishes to the best of our ability based on your condition and what's going on with your labor. But it is a part of our process to ask you what you want and to deliver on that. The next question is, could my husband and doula both be present during delivery? Yes. Even at this time of COVID, we still are allowing doulas. If you have hired a doula, you can absolutely bring your doula. You can have one essential support person, another person, and your doula. If you're COVID, that's if you're COVID negative. If you're COVID positive, you can have your essential support person and your doula. The next question is, do we delay vaccines for baby until breastfeeding is established? The vaccines that we would give to the baby are given in postpartum, and we get breastfeeding. Well, Sheila could probably better answer this, but typically my understanding is that takes about a month.
That's correct. So it takes about a month for your body to build up a milk supply that it's going to have till your baby's basically from 1 month to 6 months has the same amount of breast milk that you're going to make. So I'm not quite sure about the definition that they're using there for being established. If you're talking about the baby maybe going to the breast and latching and having a breastfeeding.
Yes, then we don't give injections right away. We actually delay all newborn interventions unless there's, of course, a reason that the baby needs a medical intervention, but we delay the vitamin K and the typical erythromycin ointment that goes in the eyes until after the initial latch, skin to skin, and breastfeeding occurs. There is a hepatitis B vaccine that is offered on postpartum. That would be before you go home, but it wouldn't be before you start breastfeeding. The next question is, do all rooms have bathtubs available for labor? About half of our rooms have bathtubs available for labor. The other half have showers. So if you would like to have a bathtub, then you need to let us know that on admission, and we will do our best to accommodate you. So half of our rooms have tubs. The next question is, does circumcision occur in the hospital? That really depends on your pediatrician and your newborn provider. Not all newborn providers do circumcisions. However, if you really want one in the hospital, if your provider would call or consult with one of our providers that does perform circumcision, there's a good possibility that we would be able to provide that. But we do routinely provide circumcision when desired, but again, it depends on your specific pediatrician.
Well, thank you very much for joining us tonight. Well, Megan, this was fun.
It really was. We had a good time, and we enjoyed talking to you and sharing our hospital and the things that we're able to offer. We're excited to have you come and be a part of what we have here to offer at Community Memorial for your birth experience. We want to honor and respect your choices, and we're here to support you in all the ways that we can to have the best experience possible for this exciting moment in your life. We're very excited to serve you. Thank you.
Bye.